Marissa, you stated the NIH protocol. Can doctors be reported when they do not comply with the guidelines? Child, I wish. That's a great question. But in short, no. Because unfortunately, the NIH ASH guidelines for the treatment of an adult acute sickle cell crisis are but recommendations that are supported by the CDC. And because they're not protocols, the doctors do not have to follow them, even though those who have seen massive decreases in patients coming into the ER just for what should be basic care because they don't have a hematologist. They've seen huge decreases in admissions, and if a patient is admitted, they've seen really large decreases in the number of days said patient is admitted. So, all in all, following these guidelines really are saving a whole lot of time, money, and frankly, stress on both ends. Um, However, you can complain when doctors violate their ethical principles. And one of those principles is that they are supposed to look at every treatment out there that is available to you. They're supposed to discuss with you their course of action and why they think it's best. But more importantly, they're supposed to discuss with you why they think it's best to stop a course of action. So, for example, I have sickle cell. I go to hospital in acute crises. My doctor says to me, "Oh, I don't believe in IV pain medication." No, you don't get to do that. You don't get to just say, "I don't believe in IV pain medication," and walk out the door. You have to give me a reason as to why you do not believe in IV pain medication for me, the patient. What is your reason? If I go and I'm admitted, right, and they have me on IV pain meds, and then suddenly they discontinue them, they can't just discontinue them and not tell me why, and have evidence-based reasons for discontinuing. I'm not comfortable is not an evidence-based reason, and it's not clinical judgment. So they're very much going against the principles that have been set before them that they are obligated to uphold. And a lot of patients don't know that, or they don't think about it. And bottom line, though, is it's not so much about them being, on alert because of this opioid thing that's happening. Like, it's understandable that you're on alert. But what's not understandable is that sickle cell is exempt from that whole situation. Sickle cell patients are exempt from opiate caps and all of that. Like, and how do I know? Because my mother made it so. That's how I know. In way back in like 2016. So it's really upsetting is that doctors' egos are just so big, and they are so very much indoctrinated to really not help sickle cell patients. They're indoctrinated that even though sickle cell is a horrible, horrible illness, the patients are quote unquote addicts, so therefore it's better to leave the patient in pain than it is to medicate them properly. And when you bring up the guidelines, what they say is their guidelines, I don't have to read them, and I definitely don't have to implement them, and then they don't. So really the question here is why? Why is your sickle cell patient so unworthy of your best efforts? Why is your sickle cell patient so unworthy of getting the best care that a doctor's education and experience can provide, and that a facility, can give as well? I hope that's helpful.